Namaste, Namaste JVWU. I JV'N Gaurav from the Faculty of Physiotherapy and Diagnostics in the Department of Diagnostic and Community Health in the discipline Radiology from JV'N University. Today we are discussing a session that is important or useful session for application of radiation imaging technique or radiographic technique and general radiation physics. So today's session will be helpful for the student to know or understand the general radiation physics or production of X-rays or any type of particles or rays or the positioning of patient. Okay. Namaste. I JV'N Gaurav. In today's session, we will discuss about the nasal bone lateral view. The lateral nasal bone view, a non-angled lateral radiograph. So, two small long bone situated side by side, oblong bone, small. So it gives the image of the two small bones situated side by side together, forming the nasal ridge. Indications for the nasal bone lateral view. This view is often primarily used in assessing various nasal bone fracture in the trauma conditions. Depending on the department, this view may be done bilaterally for comparison of affected versus unaffected sites, or unilaterally only affected sites. The positioning of patient rests the lateral aspect of the patient's head against the image receptor, image detector or receptor, adjusts the head into a true lateral position with the mid-sagittal plane parallel to the image detector or image receptor. For patient's comfort, adjust the patient's body into an oblique position. Okay, the technical factor or factor, exposure factor. The lateral projection, it is a lateral projection, the centering point 125 centimeter inferior to the nasion, inferior to the nasion. Okay. Collimation within 5 cm of the nasal bone on all sides, 5 cm to increase all sides. Okay. Orientation for unilateral side, portrait, for bilateral side, landscape orientation of the detector is used. Detector size 10 by 8 inches. Exposure factor is in the range of 60 to 70 kb, MAS 12 to 30 or 16 to 30, 12 to 30 MAS. SID 100 centimeter grid no, because the factor is not less. Image technical evaluation, nasal bone with soft tissue, nasal structure, fronto-nasal suture, superior and anterior nasal spine should be demonstrated. Nasal bones should be seen with no rotation. Practical points to remove glasses and nose piercing, to avoid artifacts obscuring important technology. This view should not replace a lateral facial bone axis. So in this session we have discussed about the nasal bone lateral axis that is used for to see the fracture in nasal bone. Okay, thank you. Namaste. Myself JV'N Gaurav. In this session, we are going to discuss about the temporomandibular joint or TN joint or view or technique. That is in for radiographic technique for full body for BScRT technique. So let's discuss about the TN joint. It allows for a visualization of the articular reversal mandibular condyle and the fossa of the temporomandibular joint, both of the TN joint. Okay, you can see these type of structure in this indication. This projection is useful in identifying structure such as seamless and explicit fracture, assessing excursion and a joint species in the trauma condition, and evaluating the presence of joint noisy, trismus, and occlusal alteration. The patient position or position. The patient is seated upright with the side of the uterus closest to the detected side of the uterus. Like if we are taking the right side joint, so TN temporal और mandibular joint, temporomandibular joint. Okay, अगर अपन राइट साइड का लेना चाह रहे हैं तो इसमें we are taking the right TN joint immediately. Then patient is seated upright with the side of the like right side closest to the detector. The head is placed in a true lateral position. Interpupillary line. I clear perpendicular to the mid-sagittal plane. Interpupillary line is perpendicular. Parallel to the detector. Okay. Oblique the body to a fixed in patient position. And reduce the object to image structure distance. Depending on the projection, open or close mouth. Instruct the patient to open their mouth side and keep it there or keep shut. Like the fracture or exposure fracture. So the technical fracture or exposure fracture are left and right lateral and open and close mouth. Left and right lateral and open and close mouth. Centering point centrally 25 to 30 degrees. Quadrant centering 5 cm superior and 1 cm inferior to external auditory millimeter. Okay, the collimation no more than 10 by 10 cm with temporomandibular joint of interest in the middle of the image. Image के middle में होना चाहिए और 10 by 2 10 cm से ज़्यादा collimation. Collimated. It is not collimated more than the calibration. Okay, orientation. Orientation of cases is portrait, detector size 8 by 10. If the exposure factor is in the range of 6 to 8 sensitivity or MA is in the range of 60 to 30. SID, so the image structure distance is 100 in case of TN plus grade. Yes, grade is used because of using high exposure factor or getting clear, getting a clear image. Next is the image technical evaluation. Means what we can evaluate after taking the TN laser projection. The temporal mandibular joint closest to the image sector should be clearly demonstrated without a superimposition. Means जो तीन joint है वो clearly demonstrate होना चाहिए और without a superimposition of the opposite temporomandibular joint. Means अगर if we are taking the right temporomandibular joint, then left is not superimposed on the right TN joint. The joint is central on the radiograph. Radiograph joint should be on the central of the radiograph. Okay. So it can be zoomed or it can be assessed by cursor or by processor. So the practical point. regulation support such as the sponges can be used to help maintain the head position. In patients that cannot stand unsupported, means without support, this projection can be performed prone to increase patient stability. Okay, so this view is performed in the TM with lateral position, or in some cases when patient is not comfortable on its own, so the stability to attain the stability or to increase the stability, patient should be in the prone position. So we can get a easier image or without any superimposing definition. Okay. So in this session we have discussed about the TMJ, temporomandibular joint imaging or technique. Technique is also called a procedure, so you can choose procedure. So the important point in a technique is the technical factor, central rate, or radiographic appearance, or image technical evaluation. And the first point is the anatomy. After that, indications or contraindications, patient preparation or positioning of patient, equipment, patient preparation, equipment, positioning of patient, central rate, and then exposure factor, a technical evaluation or radiographic technique, and then complication. If there is any complication after taking this view. Okay, thank you. I think it is very helpful for you to performing this view. Thank you. Namaste. In today's session, we will discuss about the view, that is for mastoid ear test. Okay. So the positioning of patient, or mastoid. The positioning of patient is prone or erect with the head in equilateral position. Median sagittal plane means MS plane, parallel to the film, and interorbital line perpendicular to the film. Okay, so mid sagittal plane perpendicular to the film. Okay, okay. Mid sagittal plane parallel to the film, parallel to the film. Okay, and the interorbital line perpendicular to the film, interorbital line perpendicular to the film. Okay, center 2 inches above the external auditory meatus. EAM, external auditory meatus, 2 inches above from the external auditory meatus, away from the film, with the tube angled 25 degrees towards the feet. 25 degrees towards the feet. Feet means caudal angle. Okay. So the factor, exposure factor, technical factors are: it is a lateral projection to centering point 2 centimeters above to the external auditory meatus. Okay. Orientation should be portrait or a landscape as per choice. Detector size is 10 by 8 inches. Exposure factor is in the range of KP 60 to 70, or MAS is in the range of 16 to 30. Okay, the SID 100 centimeters. Radiographic appearance: the mastoid ear cells of the side nearest to the film are clearly seen through the squamous portion of the temporal bone. The petrous portion of the temporal bone farthest away from the film is thrown clear of the mastoid cells and is seen below them. Okay. The note or important point: in all lateral views taken to show mastoid cells, the pinna of the ear nearest to the film should be folded forward to avoid superimposition of the mastoid air cells. Okay. So, in this session, we have discussed about the mastoid ear cells view, that is called Schuler's view. It is particularly important to see the infection in the mastoid ear cells or any type of deposition in the mastoid ear cells. Thank you. Thank you. The session is over. I think you are satisfied with this session. If you have any query, then put it into the comment box. I will resolve it later. Thank you. This session is over. The session is powered by digital version 2.0 JV'N University JV'N.